So when it comes to brain health, there's a few aspects of brain health that it's not just about what you eat or about exercise. When it comes to brain health, that includes cognitive health, which is how well you think, learn, and remember. There's motor function. One second, something's blocking my recording. Okay, motor function, how well you make and control movements, including balance. Emotional function, which is how well you interpret and respond to emotions, both pleasant and unpleasant. And tactile function, which is how you feel and respond to sensations of touch, including pressure and temperature. Pain included as well. Next slide. When making these part of your routine, you could help function, your function could be much more better. In that sense, it's basically you have to make sure that you get your yearly healthy screenings by your primary care, doing your 1-year checkup, manage chronic health conditions like diabetes, high blood pressure, high cholesterol, depression included, and reduce risk for brain injuries due to falls and other accidents. You have to limit your alcohol intake. You definitely need to quit smoking, and you have to receive enough sleep, anywhere from 7 to 8 hours ideally. Next slide. When it comes to modifying some modifications regarding lifestyle, you have to manage your blood pressure. Decades of observational studies have shown that having high blood pressure in midlife from the ages of 40s to your early 60s increases the risk of getting cognitive decline. Later on in life, eating healthy is very important as well. When it comes to diets such as fruits and vegetables, whole grains, lean meats, fish, and poultry, and low fat and non-dairy products are very important. You also have to control your portion size and drink enough water and other fluids as well. There's been some evidence that people who eat a Mediterranean diet have a lower risk of developing dementia, which is the diet I recommend to all my patients whenever it comes to diagnosing them with a cognitive decline. A Mediterranean diet is number one when it comes to memory. Next slide, please. Also, you have to be physically active. You cannot just stay home and watch television all day. And walking around the house does not include exercise. You have to do thorough, regular exercise, including the household chores and activities. But again, it's not just that. You have to go to a gym. You have to have, hopefully you have space in your house to have maybe a treadmill. And you have to do at least minimum 30 minutes of exercise daily. And that has been proven to be beneficial for both the heart and the brain. Keep your mind active and stay connected with social activities. Easier said than done now, given with COVID, but being interactive with others, not just staying at home and being on the computer, speaking on the phone. You have to go out, you have to have one-on-one conversations with others. And that's the way you have to engage your brain, and you could keep a better memory that way. Research shows that engaging in activities with music, theater, dance, creative writing also shows a promise for improving quality of life and well-being in older adults. And studies show that these activities seem to help maintain a well-being and may improve their cognition function as a whole. There is recent data showing that patients that have been diagnosed with Alzheimer's, that if they join, for example, a music class or dancing courses, they have improved and prolonged their life and their cognition as a whole. Next slide. When managing stress. So we all have stress on a daily basis. Easier said than done to say don't be stressed, but that is natural part of life, which is understandable. But that said, you have to have it under control. Short-term stress can even focus your thoughts and motivate us to take action. But when you have chronic stress, it causes change in the brain and affects memory, and it increases the risk of Alzheimer's and other related dementias. Next slide. So let's talk about what is dementia. So dementia is basically the loss of cognition functioning when it comes to thinking, remembering, and reasoning, and behavior abilities to such an extent that it interferes with your daily lifestyle and activities. Symptoms include problems with language skills, visual perception, and paying attention. There are more than 100 different forms of dementias. Alzheimer's is a type of dementia, and Alzheimer's is the most common type of dementia. There are 4 top dementias. Number 1 is Alzheimer's. Number 2 is a vascular dementia. Number 3 is a Lewy body dementia. And number 4 is a frontal temporal dementia. So again, there seems to always be a confusion that, oh, he doesn't have Alzheimer's, he has dementia. Again, Alzheimer's is a type of dementia. Okay, so there are different types of dementia. It's a matter of the patient being properly evaluated by a neurologist to find out what dementia you do have or they may have, and go from there regarding treatment and care. Next slide. Alzheimer's disease facts. So, Alzheimer's disease, unfortunately, is irreversible. It's a progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out simple tasks. In most people with Alzheimer's, symptoms first appear in the mid 60s, and experts suggest that more than 5.5 million Americans, most of them at the age of 65 or older, may have dementia caused by Alzheimer's. Next slide. So, what causes Alzheimer's? We don't fully understand exactly the etiology or the mechanism in which the Alzheimer's comes to be. But that said, we do have enough evidence so far that we know that it has to do due to a toxic protein, which we'll discuss on the next slide. But in people with early onset Alzheimer's, there may be a genetic mutation, may be a cause, but does not mean necessarily that it is genetic. And there is late onset Alzheimer's, which is more a complex series of brain damages that occurs over decades. The causes probably include a combination of genetics, environmental, and lifestyle factors in order to actually contract the Alzheimer's disease. Next slide. So in the slide prior, if you notice the picture, that dark, actually, can you go back to the last slide, please? So if you look at the picture, that darkness you see there, the round, that's the toxic protein that attaches to the actual nerves themselves in the brain, causing the toxicity, causing then the toxic protein, leading to the Alzheimer's. So next slide. And when it comes to Alzheimer's, there's that actual protein, which is actually a gene, and that gene is actually called apolipoprotein, and that does give someone an increased risk of developing the Alzheimer's. Most people with Alzheimer's have the late onset form of the disease, which symptoms again become more apparent in their mid 60s. But researchers found that a specific gene that directly causes late Alzheimer's, there hasn't been one yet. But we do know for early onset, which is the ApoE gene. And then with early onset Alzheimer's disease, it occurs between anyone's aging between 30 years of age and mid 60s, and represents less than 10% of all people with Alzheimer's. Again, Alzheimer's seems to be more evident in a late onset, not such an early onset. Next slide. What are the signs and symptoms of Alzheimer's disease? Memory problems are typically one of the first signs of the cognitive impairment happening related to Alzheimer's. Some people with memory problems have a cognition decline, mostly known as a mild cognitive impairment. Now, a mild cognitive impairment is extremely common, and it's actually common enough not to say that it's normal aging things that are occurring, but a little bit more prominent than just forgetting where you put your keys, which we'll talk about later. But that said, if someone has a diagnosis of mild cognitive impairment, and more specifically, a diagnosis named amnestic mild cognitive impairment, there has been data that shows that then there is a higher risk of converting into an Alzheimer's. It's kind of like a precursor. So getting evaluated the moment you start finding yourself having symptoms or other friends and family are telling you something is very important, because the sooner you come and be evaluated, the sooner it is that you could be helped. And then when it comes to the brain and what happens exactly with the brain in Alzheimer's, when you look at the picture here, this picture is of a PET scan. A PET scan tells you the metabolism of the body, and specifically in this picture of the brain itself. And if you see in the first brain, that's what a normal brain would look like. And a mild cognitive impairment is the second picture. And in an Alzheimer's patient is the last picture. And if you notice in the Alzheimer's, there is less red and there is a larger opening in the middle, and that's called the ventricles in our brain. And that basically shows that the brain is aging and shrinking, which happens to all of us, but it's more prominent in patients with Alzheimer's. Next slide. So there's mild, moderate, and severe levels of Alzheimer's. A mild Alzheimer's disease is basically wandering and getting lost, trouble handling money and paying bills, repeating questions, taking longer to complete normal daily tasks, and personality and behavioral changes may be present as well. People are often diagnosed at this stage. When you hit the moderate stage of Alzheimer's, language, reasoning, sensory processing, and conscious thought starts to become affected. Memory loss and confusion grows worse, and people begin to have problems recognizing family and friends. Unable to learn new things, carry out multitasking events, such as getting dressed or coping with new situations becomes an issue. And at times as well, may develop hallucinations or illusions, or paranoia may be part of also the behavior at that point. And then with severe Alzheimer's disease, ultimately the plaques that I showed you earlier and the tangles, which is part of the plaques, spread throughout the brain and the brain tissue shrinks significantly. People with severe Alzheimer's cannot communicate and completely depend on others and for their care. So near the end, the person may be in bed most of the time as the body continues to shut down. Next slide. To diagnose Alzheimer's, doctors may ask the person and the family member or friends to question the overall health. The use of prescription and over-the-counter medicines and diet and past medical history and the ability to carry out daily activities and changes their behavior and personalities, all the things that we question the patient regarding memory and determining whether they do or not have Alzheimer's. Conducting tests of memory tests, problem solving, attention span, counting, and language is also performed. Carrying out standard medical tests such as blood tests and urine tests to identify other possible causes of a memory decline. We perform brain scans such as either a CT scan or an MRI or the PET scan to rule out other causes that may not actually be Alzheimer's. And then Alzheimer's disease can be definitely diagnosed only after death, unfortunately, by linking clinical measures with an examination of brain tissue and the autopsy. And the reason that is because we have to look for the actual protein, the toxic protein, and the way you could really definitely diagnose that is getting a biopsy of the brain. But that does not mean that you are not you won't be able to find out do you or do you not have it. Again, getting a full workup, we still have other methods in which we could diagnose the Alzheimer's and be able to start medications if need be. Next slide. So what's the difference between normal aging memory changes and Alzheimer's? When it comes to normal aging, making a bad decision once in a while, that's okay. Missing a monthly payment, that's okay. Forgetting which day it is and remembering it later, that's okay. Forgetting which word to use, word retrieval, that's okay. Or losing things from time to time, as long as you find them. Now, when it comes to an Alzheimer's, more prominent, everything that I just said is a little bit more prominent, a little bit more advanced. So you're making poor judgments and decisions the majority of the time. You're having problems taking care of your monthly bills. You're losing track of the date and time and of the year. You're having trouble having a full conversation, and you're misplacing things often and being unable to find them. So those are the differences between normal aging and when it becomes more of a concern regarding a possible Alzheimer's. Next slide. So how is Alzheimer's disease treated? So that's a very hefty question because unfortunately we don't have a magic cure yet. We don't have a magic pill that brings memory back or that makes memory better. We are working on it. That said, there are drugs, well, medications that do help delay the process of the memory loss. So in addition to taking those medications, we have to maintain a healthy lifestyle with, again, controlling your blood pressure, your cholesterol, if you have diabetes, and also having a good mental health with regarding stress and depression is very important. Doing the exercise and a proper diet, okay? And we're looking into some new treatments regarding the Alzheimer's. And as you guys, I'm sure the majority have seen on the news that there is a new medication that came out for Alzheimer's that is IV infused. Unfortunately, this medication has not been fully proven yet to be optimized beneficial. It's still in the trials of being actually tested to see if it is beneficial. But this medication pretty much does the same as the medications that we give orally. It helps delay the process, but it also helps destroy that protein that becomes toxic and hopefully prevent the brain from building up more of that toxic protein. Next slide. So when to visit the doctor for memory loss? If you, a family member or a friend, has problems remembering recent events or thinking clearly, then you talk to your doctor. If he or she may suggest a thorough workup, and before you know it, we could find out that it's not even a memory decline. Before you know it, it's a vitamin deficiency, a thyroid problem. So being evaluated first before you start assuming that you have a real Alzheimer's or any cognition decline is very important. Next slide. Any questions?
So we'll wait to see if anyone has any questions. Dr. Zisman, I do have one. Do you recommend people getting screened For the APOE gene, if they have a family history before they start showing symptoms, like, is it worth it to get screened before you even may consider or think you have some sort of memory decline?
No, I don't recommend you get pre-screened. You have to first, I recommend that anyone be evaluated the moment they start to present with symptoms.
Okay, and at this point, audience members may unmute themselves or post any questions to the chat if they would like them answered.
I have a question, doctor.
Yes.
My mom is 96 and a half years old, and shows clear signs of a moderate dementia. But she's never been diagnosed formally. Does it make any sense to make her go through diagnostic testing at this age?
So I understand. At the end of the day, is she independent? Does she require assistance to bathe herself? So that's where it comes to the questioning. If the patient is very independent, and then even at her age, I know I have a lot of 90-year-old patients who are extremely independent, still golfing, going to trips, and then all of a sudden they start noticing a decline, then that's when you would definitely have the patient evaluated because their baseline was very independent and very successful. If at baseline the patient at 90 is ill from other things, from heart, from the lung, or other things that may cause her not to be at the best stage of health, and there is a memory decline, then that would all depend on the family and the patient themselves. At the end of the day, unfortunately, there's no magic cure yet to help reverse the memory damage, but there are medications that help delay it.
Thank you.
Of course. Any other questions?
I know we discussed this a little bit before everything started, but I know that a lot of people are concerned about the potential long-term effects of COVID on aging and the brain.
Okay. So there hasn't been any direct evidence yet that COVID has caused any permanent brain damage, leading to then later on having a memory decline. That said, there has been new evidence showing that patients have been complaining of what we're calling a foggy brain syndrome. And basically, that seems to be occurring in patients who were very ill with the COVID. Not that you just had it for one day and like you kind of got over it on your own over the course of a week or two. Mainly the patients that required to be intubated, that were very ill, the oxygen saturation rate dropped very low. Those are the patients who have been suffering with foggy brain syndrome, but there's not enough evidence yet showing proof that there is any permanent damage occurring. If someone had COVID and is suffering from foggy brain syndrome, they need to be evaluated by a neurologist to do a proper full workup.
Okay, thank you. We have a request to talk more about amnesiac memory disorder, which you mentioned in your presentation.
Amnestic, yes. So there's something
Amnestic.
known as amnestic mild cognitive impairment. Amnestic means amnesia, you totally forget. So that means, for example, is that I asked you, okay, tomorrow we're gonna go have lunch and we're gonna go have Chinese food. And then literally I go, okay, and I pick this up and I'm like, so what are we gonna do tomorrow? What are we gonna eat? And then you'll tell me, I just told you, tomorrow we're gonna go have Chinese food. That's the amnestic part. You literally draw a blank and you honestly don't recollect. But if I tell you, oh yeah, I told you Chinese food, you'll be like, oh yeah. Yeah, you're right. Sorry, you told me that. That also is part of the amnestic part. And if a patient is having these events occur, again, warning sign, go get evaluated by a neurologist, have a full workup completed, because that's the perfect timing to start you on medication, to do cognition therapy, to make sure like, okay, is this what's going on? What is it? Is this the memory decline normal? Is it not normal? And then that way we could help you as opposed to you waiting over a year and then coming when it's too late to even help delay the process. Okay.
Are memory screenings included in annual physicals?
No, they are not. I'm not an internist, so I myself, so I want to say they're not because it's not part of the physical. The doctor will ask you any memory problems or anything you want to go over, but that I'm aware of, I don't believe it's part of the actual routine. Asking for depression and anxiety and mood questions is part of a routine.
Okay. And is dementia more prevalent in women than men?
There is no link.
Okay.
There's no preference.
Okay. Yeah. Thank you very much. Does anybody else have any questions they would like to add or post in the chat? If you don't feel comfortable posting it publicly, feel free to message it to me, Miriam Safra, and I'll convey it to Dr. Zisman.
Here we just have a little bit more information if anyone needed additional resources. And Dr. Zisman's contact information. We can share this PowerPoint with all the attendees if anyone would like the resources and the links on there, because there's some information on there.
May I ask one other question for a
course.
specific situation? So again, 96-and-a-half-year-old mom with some dementia. There are certain things like that will trigger her. And I'm curious to understand that. Like if I say, okay, it's time to go to the podiatrist and get your nails cut, she'll freak out. She'll, no, it's not necessary. No, we're not. How do I handle that? And what would cause that certain thing to be like a trigger for her?
So notice what you said, like telling her that she has to leave her home. You're asking her to leave her zone, her comfort zone where she's in control. And that's what happens with an advanced dementia or certain dementias, or like with Alzheimer's. The patient is always better in their own realm, in their own home, in their own environment. The moment you take them out of that, it becomes an anxiety. And that's where the paranoia, the hallucinations, the illusions begin. And it just becomes too much for the patient. So what you have to do is start prepping her, not last minute. Mom, next week, Tuesday, we have an appointment. I don't want to go. I don't need it. It's okay, Mom. Don't worry. Next day. You have to just and show her feet. Mom, you see, this is healthy for you, because that way you could walk to the bathroom. That's way you're safe. That way your feet don't get infected, and you have to do reassurance. And then if you see that it becomes very difficult to take her out of the house, that's when you have to discuss with her primary care, with her neurologist, is that way they could provide you with possibly a medication to help her just calm down a little bit, enough that she could have the courage to leave the house and go do important things. I see her doctor.
Oh, thank you very much. Because I was thinking that if I told her too much in advance, it would cause more anxiety, but I hear what you're saying. Okay.
Yeah, and most importantly, I always tell my patients, get your family member a big calendar. That way, every morning you make them wake up. Today is Tuesday, February 2nd, cross it out. Tomorrow's February 3rd, podiatry appointment. Write it down. So it's like, Mom, remember, look at the calendar. Look at the calendar.
Okay.
You know, like guide her that way, and it's very helpful.
Thank you.
I have a question too. You mentioned that there are many types of dementia, Alzheimer's only being one type.
Yes.
And there are a few medications now. Is the medication the same no matter what the type is?
Very good. Yes. So the medications that exist that help delay the process have all been designed with the thought of Alzheimer's, because that's where the foundation and the money and the research is, because it's the most aggressive one. But it has been proven that it also is effective, for example, for a vascular dementia. A vascular dementia is the second type of most common memory decline, and that one's effective for that kind as well, those medications. It all depends which one you have, and then we know what medications will be most beneficial for the patient.
Can you do a confirmation of diagnosis for vascular dementia?
Oh, yes. An MRI. An MRI and a neuropsychological evaluation test are the two tests that will confirm it for both Alzheimer's, especially for vascular dementia. An MRI is how you see it. You see the white matter changes, it's called.
Thank you.
Dr. Zisman, would you mind going over which foods to avoid again?
So you want a Mediterranean diet. So following a Mediterranean diet is what I always recommend. Basically, that means extremely once in a blue moon, rare, you're going to have red meat and sweets. So there is a website that's available. If you go on to Google, there's, I could actually share it with you guys, that I always give the link and actually print it out in my office and provide a whole listing for my patients on what foods they could eat and what I recommend regarding the Mediterranean diet. I could share that with you guys.
We also have a question. Okay. What about if you are going to do something and forget what you are about to do?
Oh, that's normal. Yeah, that's normal. That's common. So basically, you go upstairs to the room and I'm gonna go get my glasses. And as you're literally going up the stairs and going to the room, you walk in the room and you're like, man, what was I gonna get again? And it's like a real bummer. And you're just like, you honestly drew a blank. And then all of a sudden you'll sit there and you'll be like, oh yeah, my glasses. That's normal. That's all normal. It's only when you start, like, for example, putting the milk inside the cupboard, putting the salt inside the fridge. Those are warning signs. When you're paying the bills and you're overpaying, not paying, you're overdue. When you're driving and you know from left and right, but then you realize, oh my God, how do I get home? And you drive from home into the store for the past 25 years and you don't know how to get home from the store that you've been to for 25 years, that's a warning sign. But like doing something, saying, what was I gonna get again? Or where did I put my keys? That's normal as long as you find it and you'll remember. That's when you start writing things down to help yourself, because it becomes more difficult as we get older to multitask and to be as like active and do all that stuff that we used to do at a younger age. It just naturally starts to decline as we get older.
And in regards to a change of environment being scary, leaving the house, would you recommend like having a podiatrist come to the house to help her there? Or do you think it's sufficient to give someone sufficient warning that they'll have to
No,
leave?
you have to just warn the patient. Having someone come to the house, it's only important if you want for physical therapy. Like physical therapy at home, I recommend, but the patient should go to podiatry. They need to be properly evaluated. And most importantly, this is how you train the patient. You have to continue to show them that it is safe to go outside. It's part of cognition therapy. So it is important for her to leave the house, get vitamin D, speak to people, see others. No one should just shut down at home quietly and stay on their own. No.
I heard that losing your teeth makes you more likely to develop dementia, being unable to chew your food. Is there any correlation there?
I have not heard or seen any data showing any proof of that. No. If anything, not having teeth and not even putting in dentures could lead to something called an oral dystonia, in which the patient will constantly be doing this and constantly have a motion. And it's just because they don't have teeth, and that's what it could cause it. If you literally put a patient that has that movement, put teeth inside, like put dentures, it stops. So that's the only thing I've seen in regards to neurology. But I have not seen anything regarding memory decline if you don't have teeth.
It does having constant inflammation correlate with developing dementia?
Inflammation where? Joint inflammation, stomach inflammation. There's different types of inflammation in different locations. It all depends.
Joints.
Okay, so inflammation in the joints has not been linked. And if anything, if the only thing that has been linked with memory decline regarding any diagnosis is diabetes, high blood pressure, high cholesterol, top 3. And then goes anxiety and depression. So top 5. But actual inflammation of the joints, having rheumatoid arthritis, for example, or osteoarthritis, that has not been linked to any type of dementia. There is no data yet showing any of that.
Okay. Does anybody else have any questions that they'd like to ask? We're being asked for you to repeat the information about joint inflammation.
Okay, so regarding joint and inflammation, arthritis does not lead to a dementia. A rheumatoid arthritis doesn't lead to a dementia. These are all joint conditions that cause our swelling. So that the actual diagnosis itself does not lead to a memory decline. Now, medications that someone could be on for those types of conditions, it all depends which one they're on and what side effects they have, may have some sort of contribution. That would all depend. They will have to be properly evaluated and do brain scans and cognition tests. For example, what I'm trying to say is that sometimes we use very strong medications that are chemotherapy based for certain inflammation conditions, and chemotherapy medications can cause some memory decline. It's called chemo brain. but that slowly improves over time in some patients, and in some patients it may lead to a more permanent decline, which is then leads to a more of a vascular dementia. So it all depends. But inflammation on its own or arthritis on its own does not cause any memory decline.
Okay. What were the top 3 conditions that do lead to dementia?
So diabetes, hypertension, high cholesterol, stress, anxiety, and depression. And then of course, alcohol is also included. Alcohol and drugs.
We have a request. Do you provide assessments in Spanish?
Yes, I do. I am Spanish. Yes.
Okay. Does anybody else have any questions they'd like answered? You can either unmute yourself to ask, or is it okay to not tell a dementia patient that we have sold her house?
So that's a tricky question, because you cannot automatically assume they have the dementia. If they've been properly diagnosed, then the patient needs to be aware of it as well. For example, sometimes it's very hard because patients, for example, with Alzheimer's, they don't realize they have a problem. And sometimes by the time they come to me, it's already too advanced. But I still tell my patients, and I explain it to them to an extent that they do understand that there is a memory problem. And then you help guide them, and we tell them, listen, so given that you have a memory problem, the house, you cannot be in the house by yourself anymore. It's not safe. What we're going to do is you're going to move in with me. You're going to move in with Aunt Titi, whoever you want, and however the situation is going to end up. And then you say, and we're going to sell the house. That way you don't have to worry about the bills. And then you just guide them that way. So it all depends what kind of memory decline they have. Because like again, Alzheimer's, they won't remember likely what you're telling them, but a vascular dementia patient, they sure will. So you cannot take away that from them. So it is always important to speak the truth to the patient.
Someone would like to know if you're taking new patients.
Oh yes, absolutely. Yes. Just always remember, it's not what you tell the patient, it's how you say it. Okay, so it's hard sometimes. And the problem with Alzheimer's, most importantly, the problem is not the patient with the Alzheimer's. Who really gets affected is the family. And that's where it hurts. That's where we all fall apart, because we can't stand seeing them at that stage. But what I always tell my patients, the most important thing you need to realize is that, yes, they have Alzheimer's, but they're okay. They're in their own world. They're happy. They're content. Otherwise, they're healthy. You just manage everything else, but they're okay. They don't remember what you just said, but that's okay. They're okay. They're not crying. They're not trying to hurt themselves. So they're okay. They're safe. And it's just something that then it's the family that needs the hand holding and the therapy and the guidance to understand the situation of Alzheimer's. Okay.
Okay, and I see someone with their hand up.
Okay.
If they would.
Yeah, it's Miriam Zucker. Are you saying that there are different manifestations of memory loss based on the diagnosis? If it's vascular as opposed to Lewy body, as opposed to Alzheimer's disease?
Yes, they all present differently, but they all present with the same number one thing, memory loss. So if you're having memory loss and you're finding it becoming difficult, and if other family members and friends are telling you something, you have to be evaluated to determine which memory loss is it, because there's just so many. Out of the 100 and plus types of dementias, there are some reversible ones. One that it's a thyroid issue or vitamin B12 deficiency or an infection known as syphilis. So there are things that could be done. So there are workup that before you know it, the patient's not even have a memory problem. They had a urinary tract infection and they just got really sick from it. Or maybe it's a medication making them very sick and it's not an actual dementia. So just be evaluated, do a thorough workup, and then we know exactly what's going on and have a better understanding.
Thank you.
Of course. Anything else, guys?
Okay. Anybody else have questions? All right. I think it doesn't look like anybody else has any questions. So with that, Thank you, everybody, for coming and providing a wonderful dialogue. Thank you so much, Dr. Zisman, for lending us your expertise.
No worries, my pleasure.
And thank you, Amanda, for helping to arrange all of this. If you missed any part of this, or if you'd like to go over it again, a recording will be made available on the Tuckahoe Library website. I wish everybody a happy and healthy week, and I hope to see you all back soon for another program. Thanks again.
All right.
Take care, everyone.